Thanks, Maureen, and good afternoon, everyone. My name's Dr. John Raymond, and I'm President and CEO of the Medical College of Wisconsin. Thank you for joining us here today. I'd like to announce that on May 29th, 2015, the Medical College of Wisconsin Board of Trustees approved the development of a School of Pharmacy at the Medical College of Wisconsin. The school is expected to be located here in the Milwaukee region on our Wauwatosa campus in existing space. We expect to matriculate 60 students with the first class in either 2017 or 2018. So that's 60 students per class. So why is MCW adding a School of Pharmacy? The vision for our School of Pharmacy is to prepare the next generation of pharmacists for the new demands on the profession. There is an increasing demand for pharmacists who can provide expanded service, high-end consultations, as well as primary care in underserved settings. We believe that with our strong medical school and the great partners we have here on our Milwaukee Regional Medical Center campus, that we can make a unique contribution to train pharmacists to the full extent allowed by licensure in Wisconsin. MCW also has the ability to teach pharmacy students in an interprofessional setting, which is how these pharmacists will eventually practice. There is a maldistribution of pharmacists in Wisconsin. We're quite aware of that. And we hope to address that maldistribution by providing a pathway for students to teach and learn in underserved regions of the state, both here in Milwaukee and in the northern parts of the state. MCW's graduates, both in medicine and pharmacy, will be trained to achieve the triple aim: better care, better health, lower cost, which means higher overall quality. We have a highly qualified faculty right here on this campus, which means that we can offer specialty tracks in fields critical to medicine and healthcare at large as we move forward. These include, but are not limited to, pharmacogenomics, cancer, psychiatry, and other high-end specialties such as mental health. Through a School of Pharmacy, MCW is investing in the future health of Wisconsin. Just a few facts: the total cost of the startup and ramp up for the School of Pharmacy is estimated to be about $30 million. And I'm pleased to announce that our Advancing a Healthier Wisconsin Endowment has awarded us a grant of $3 million to help with the startup costs of the school. Recruitment is already underway for the founding dean. We've retained Isaacson Miller as the search firm, and they've already vetted a large number of candidates who will be visiting campus in the next month or so. Finally, I'd like to acknowledge the efforts of the leadership of MCW and our faculty. Drs. Bill Campbell and Dr. Cheryl Marana, who are both here today, were instrumental in working with our faculty, staff, and partners to put together the plan for this project. I'd also like to thank our internal and external advisory committees, our hospital partners here on this campus, and also the Zablocki VA Medical Center for their support, the special committee of our Board of Trustees, who included Dr. Joe Geenan, Steve Roll, Ricardo Diaz, Jay Williams, and Wayne Oldenburg, who helped us to craft this plan. So now I'd like to turn the podium over to Bevan Baker, City of Milwaukee Health Commissioner, for further comments.
Well, thank you, President Raymond, and thank you all for joining us today. The City of Milwaukee Health Department has been around since 1867. We have one primary goal, and that is to promote healthy communities and to safeguard the community's health. And while we have some challenges in Milwaukee and we've identified some disparities, it is clear that we must work together in partnership. The Medical College of Wisconsin seeks to address health disparities within our community by identifying the causes of those disparities, going upstream, and making certain that individuals can access care. Medical College of Wisconsin has identified a maldistribution of providers, particularly in the urban center of Milwaukee, and has developed some pathways to address this issue and programs to augment what's on the ground. I'm particularly excited about a School of Pharmacy here and how it will address the need to train a highly qualified, specialized healthcare provider. The synergy that would exist between a school of pharmacy and a school of medicine here in southeastern Wisconsin and the effect that it has on the state of Wisconsin and beyond is tremendous. The ability to address chronic disease and have specialty pharmacy care is a key component of moving forward population health in our community. So this is an exciting time for our city, our greater Milwaukee area, and the state of Wisconsin. And I'm delighted to see this effort, and I'm delighted to see the students that will come and the providers that will do great work within this community. And the investments will be continuous, and the return on that investment through the synergy between a medical school and a school of pharmacy is tremendous. And with that said, I'd like to invite to the podium now Paula Lucy, who's the chair of the consortium here at the Medical College of Wisconsin and my favorite nurse. Thank you, Paula.
Thank you. Thank you all for being here today. The MCW School of Pharmacy will complement a high-quality education offered at the MCW School of Medicine. As a registered nurse, I believe that the nurses, doctors, pharmacists, and indeed all healthcare professionals of the future must be able to collaborate, communicate, and work together in order to provide high-quality patient care in the future. Healthcare professionals in different fields must, in the future, work together and learn together in order for healthcare to be of high quality. The MCW School of Pharmacy will help to increase access to healthcare as well as provide quality good care in several ways. First, by educating pharmacists who wish to practice in underserved areas. Secondly, by educating highly qualified pharmacists who can provide expanded services, which means patients will have additional points of access into the healthcare system. And lastly, by educating pharmacists in specialty tracks to address healthcare needs such as psychiatry, cancer, and geriatrics. The Healthy Wisconsin Partnership Program, of which I'm honored to be the chair, has a 5-year program focused on being a change maker. This approved and new program, new school, is truly a change maker, and I'm excited to see its implementation and its impact on the future of healthcare in the state of Wisconsin. Thank you.
Thank you very much. John Raymond, Devin Baker, Paula Lucy. Anyone have any questions for some of our esteemed speakers today?
If you could just go back to the podium.
Podium?
Why did you guys feel it was necessary to start a pharmacy program? What was lacking that inspired this to come about?
Initially, our desire was to have interprofessional education opportunities for our medical and graduate students, and we thought the best way to accomplish this was to have our own students. We're certainly partnering with other healthcare institutions and also other educational institutions, but the primary driver was to provide a high-quality, team-based education.
Is the region underserved with pharmacy schools?
It's a great question. The question is the region underserved in pharmacy schools? There's a pretty significant national debate ongoing about whether there's a true shortage of pharmacists or not, and the impact of a number of startup pharmacy schools that have occurred over the last 10 years. What we're going to focus on is trying to address a clear maldistribution of pharmacists in the state, especially the underserved areas, urban areas like Milwaukee and the northern parts of the state, while also providing the opportunity for students to do some things that typically aren't practiced by pharmacists of today. So we hope that our students will become high-end specialty consultants and also have the ability to render primary care as well as consultation with the patients. Again, we believe that because we're a freestanding medical school, we're ideally situated to be able to provide that personalized but team-based education.
Was this something a long time in the planning, or did this just come about?
When I interviewed for the presidency here in 2010, was one of my dreams to provide an opportunity for MCW to grow, not just in terms of expanded geography, but expanded programmatic offerings looking to the future and knowing that healthcare is a team-based sport now. And so the pharmacy school was a critical aspect of that vision. We've worked for the last 2 years to define the vision, to get buy-in from our faculty and our partners, and to assess the financial and programmatic feasibility. So yeah, this has been ongoing now for 2 years in earnest, and the vision's been in existence for about 5 years.
And again, the plan is to have it right here on campus. Is it going to be hard to find space? I don't know.
We'll make sure we find space. This is a huge complex, and we have an enormous talent base here who really want to teach the pharmacy students. One thing that I want to point out is our School of Medicine is committed to funding whatever startup costs we can't get from outside funding sources, and that is quite a remarkable event. I'm not aware of any other situation in which a School of Medicine has made that kind of a gift to a School of Pharmacy with no expectation of a payback to the School of Medicine. So it's important for us to have the school embedded in the fabric of this campus.
I'm assuming some of these students will be exposed to parts of the city that typically they may not have been exposed to before. You talk about maybe keeping these students in the area?
We would love for our students to have the opportunity to rotate through federally qualified and community health centers, to work with Commissioner Baker, to try to develop opportunities for them to have an affinity for underserved areas. And I actually would like to invite Commissioner Baker to comment on the opportunities that we might have. Like to step up here, Bevan?
Oh, thank you, President Raymond. I think the opportunities are endless. One, we know that there's critical need in our greater Milwaukee area, in the city of Milwaukee. But also, I think the presence of the Medical College of Wisconsin School of Pharmacy and their students sends a message to our community, it sends a message to our city and our state that we are about changing the disparities that exist on the ground. I think within the public health system, there needs to be connections, and John talked about some of those with federally qualified health centers, but also the role of the county, the city, and the state, and making certain that we have a continuum of care that can be one that will move forward some outcomes. And I think that's exactly what we hope for. We hope to see that across the board. And I think one of the things that we do as a safety net provider in public health is to make certain that there is a actionable referral system to make certain that patients who are falling through the safety net get the care that they need. Having pharmacy practitioners who are highly qualified and specialized to do things that they haven't done heretofore creates an opportunity to change those disparities in terms of providers. The other thing, I think it makes Milwaukee and Wisconsin more attractive. It makes us more attractive to students, bright young students in other states who are looking at opportunities. So it gives Wisconsin, I think, a leg up, and it helps propel not only the medical school and the School of Pharmacy for a regional and a national footprint. So this is about fixing what's happening on the ground, but it's also about the future. We need students to choose Milwaukee, to choose Wisconsin, to choose Milwaukee County and southeastern Wisconsin, and this is just another key part of our comprehensive effort as providers. So we're excited about that. This is an investment, and it's one that both the city, the county, and I think the state are certainly happy to see a private provider stand in that space for much need.
Are there any other questions? Well, then I'd like to thank all of you for your interest in coming here in the middle of a nice Monday morning to speak with us. Oh, I'm sorry.
So you said the first class would be in 2017 or
Either 2017 or 2018. We've been working with the accrediting board, the ACPE, and we believe that it's feasible to do a start in 2017, and we would like to do that. But we also want to make sure that we have a high quality product that is going to be individualized for what will amount to be a very small class of 60 students. So it could be 2018.
And how long is the program?
That's another good question. We're leaving open the possibility that there could be an accelerated pathway to get through pharmacy school in 3 years. There are about a dozen schools that offer a 3-year program right now, but the traditional curriculum is delivered in 4 years. Once we hire the new dean, they'll make a recommendation on the curriculum length, whether it's 3 or 4 years, and the start date, and then we'll work with the ACPE to make that happen. Thank you.
Are you gonna hire anybody else?
Pardon me?
Are you gonna be hiring anybody else?
Yes, in order to be accredited by the ACPE, you not only have to have the dean, but you need a small number of faculty and staff support before you can even apply for accreditation. We would hope that we'll have a dean identified and at work by no later than the end of this summer, and that we'll be able to submit our initial accreditation proposal in January of 2016. Obviously, we've already engaged a search firm in the hopes that the Board of Trustees would give us the go-ahead. They've already been doing quite a bit of work, and I can say that we're extremely pleased with the level of qualifications and interest that we have from highly qualified pharmacy leaders from across the country. So we're fairly confident that we'll be able to bring a superb leader on board within that short time frame.
With a student body of 60 students and a dean, how many staff, additional staff, would pharmacy schools see?
It's a good question. Cheryl, what is the latest pro forma, say, for the number of staff?
The number of staff, that I'd have to check. We would have, if we go with 3-year curriculum, we'll have 21 FTE faculty. If we go with a 4-year curriculum, we'll have 24. And I'll check on the number of staff.
So the number of faculty, regardless of 3 or 4 years, is going to be in the low 20s. In terms of total full-time effort, obviously we'll have dozens of people involved above and beyond that that'll be part-time clinical teachers. And in terms of staffing ratios, we can give you the answer if you need that.
Mara just said it's 8 to 10 staff, at least initially.
8 to 10 staff,
Thank you.
plus the faculty. All right, well, thank you very much. We're very excited about this, and we appreciate your attention.